Magandang araw po sa ating lahat. We are back with our rationalization at ang ating ira-rationalize ngayon are common questions in fundamentals of nursing na possible na lalabas sa board exam. So without further ado, let's start. Number 1. The client has been diagnosed to have congestive heart failure. Which position will the nurse appropriately place the client? A. Semi-Fowler's, B. Left lateral position, C. Reverse Trendelenburg position, and letter D. High Fowler's position. Ang sagot po natin dito is letter D. The client with CHF is best placed in high Fowler's position. This position relieves dyspnea and reduces cardiac workload. This is very common. Ang position ng patient with CHF is high Fowler's position. Again, CHF, position po ng patient, high Fowler's position. Okay? Number 2. A client is diagnosed to have pleural effusion secondary to tuberculosis. After thoracentesis of the right lung, in which position does the nurse place the client? A. Right side, B. Left side, C. Semi-Fowler's, and letter D. Sitting upright. Our answer here is letter B. Left side. After thoracentesis, the client should be placed toward an affected side for at least an hour to prevent leakage of fluid into the thoracic cavity. Imagine mo na lang yung bottle with water na walang takip. Kung ilalagay mo sa table na nakatayo, hindi matatapon yung tubig. Pero, kung nilagay mo sa table na nakabaliktad or nakaupo yung opening ng bottle, syempre, matatapon yung laman. Ganyan din po after thoracentesis. Ipoposition po yung patient into the unaffected side para hindi mag-leak yung fluid into the thoracic cavity. Okay? Again, after thoracentesis, we must position the client into the unaffected side to prevent leakage of fluid into the thoracic cavity. Therefore, our answer here is letter B. Kung ang thoracentesis ay sa right lung, ipoposition mo yung patient sa left side po. Okay? Our answer here is letter B. Next. The nurse will administer a cleansing enema to a client with fecal impaction. The nurse properly places the client in which position? Very common question po. Our answer here is letter A. On administration of enema, the client is placed on left same position so that the enema solution can flow by gravity in natural anatomical position of the colon. Again, the position of the client in administering cleansing enema to a client with fecal impaction is left same position. Okay? I-base po natin sa anatomy. Next, number 4. The client had undergone transsphenoidal hypophyseectomy for tumor of the pituitary gland. The nurse places the client in which position? So, ano muna ang transsphenoidal hypophyseectomy? Transsphenoidal hypophyseectomy is a minimally invasive surgery that removes tumors from the pituitary gland through the nose. So, ang sagot natin dito is letter C. After transsphenoidal hypophyseectomy, the client is placed in semi-Fowler's position to promote venous drainage and drainage of fluids from the surgical site. Semi-Fowler's position po. Okay? Number 5. During vaginal examination done on an examination table, the client is best placed in which position? Very common, ang sagot natin dito is letter A, lithotomy position. This is to facilitate the visualization and examination of the area. Sagot po, letter A, lithotomy position. Number 6. What is an example of a subjective data? A. Heart rate of 68 beats per minute. B. Yellowish sputum. C. Client verbalize I feel pain when urinating. And letter D. Noisy breathing. Alam na natin to. Our answer here is letter C. Client verbalize I feel pain when urinating. Ano ba yung subjective data? Subjective data are those that can be described only by the person experiencing it. Okay? Therefore, only the patient can describe or verify whether he is experiencing pain or not. Okay? Yung letter A, B, and letter D, ito naman yung ating objective data. And objective data are facts that can be seen, heard, can be measured, and can be observed. Okay? Number 7. Jake is complaining of shortness of breath. The nurse assesses his respiratory rate to be 30 breaths per minute and documents that Jake is tachypneic. The nurse understands tachypnea means. Our answer here is letter C, respiratory rate greater than 20 breaths per minute. A respiratory rate of greater than 20 breaths per minute is tachypnea. Alam na natin yan. Yung letter B, a blood pressure of 140/90 is considered hypertension. Yung letter C naman, pulse greater than 100 beats per minute is tachycardia. Yung letter D, frequent vowel sounds refer to hyperactive vowel sounds. Alam ko, madali lang yan para sa inyo, pero this is review of the basics. Number 8. The nurse listens to Mrs. Sallen's lungs and notes a high-pitched hissing sound or musical sound. The nurse documents this as A. Wheezes, B. Ronchi, C. Gurgles, and letter D. Vesicular. Our answer here is letter A. Wheezes. Wheezes are indicated by continuous, lengthy, musical, and is heard during expiration, or in severe cases, maaari nating marinig ito during inspiration. Anong sakit ba natin kadalasan naririnig ang wheezes? Very common, naririnig natin yan sa asthma. Again, high-pitched hissing sound or musical sound is called wheezes. Number 9. The nurse in charge measures a patient's temperature at 101 degrees Fahrenheit. What is the equivalent centigrade temperature? Ang sagot natin dito is letter B, 37.95 degrees. To convert Fahrenheit to degrees Celsius, this is the formula. Tignan na lang po natin sa screen. So, input natin yung data. 101 minus 32 plus 0.55 is equal to 37.95. Paano naman pag degrees Celsius into degrees Celsius to Fahrenheit? Degrees Celsius to Fahrenheit, ito naman yung formula. Degrees Celsius times 1.8 plus 32. Okay? Basta ang sagot natin dito is letter B. Number 10. Which approach to problem solving tests any number of solutions until one is found that works for that particular problem? Gagamit daw ng any number of solutions hanggang makahanap ng isa na mag-work. Our answer here is letter D, trial and error. Very obvious po. Trial and error. Number 11. What is the order of the nursing process? Easy question na hindi dapat natin nakakalimutan. The answer here is letter C. Assessing, diagnosing, planning, implementing, and evaluating. ADPI. Okay? Number 12. During the planning phase of the nursing process, which of the following is the outcome? A. Nursing history. B. Nursing notes. Letter C. Nursing care plan. And letter D. Nursing diagnosis. Our answer here is letter C. Nursing care plan. The outcome or the product of the planning phase of the nursing process is the nursing care plan. Again, the outcome or the product of the planning phase of the nursing process is a nursing care plan. Letter C. Number 13. Which expected outcome is correctly written? The patient will feel less nauseated in 24 hours. B. The patient will eat the right amount of food daily. Letter C. The patient will identify all the high-salt food from a prepared list by discharge. And letter D. The patient will have enough sleep. Our answer here is letter C. The patient will identify all the high-salt food from a prepared list by discharge. Expected outcomes are specific, measurable, realistic statements of goal attainment. The phrases right amount sa letter B, less nauseated sa letter A, and enough sleep sa letter D are vague and not measurable. Therefore, letter C is the answer. Number 14. Which of the following behaviors by Nurse Jane Robles demonstrate that she understands well the statements of effective charting? A. She writes in the chart using a number 2 pencil. B. She noted appetite is good this afternoon. Letter C. She signs on the medication sheet after administering the medication. And letter D. She signs her charting as follows. JR. The correct answer here is letter C. She signs on the medication sheet after administering the medication. Tandaan, a nurse should record a nursing intervention after performing the nursing intervention like giving medication. Recording should be done using a pen. A pen, hindi pencil. Mali ang ating letter A. It should be complete and signed with the nurse's full name and title. Kaya mali din ang ating letter B and letter D. Bawal ang initials. Okay? Number 15. What is the disadvantage of computerized documentation of the nursing process? Very common question. Our answer here is letter C. Concern of privacy. A patient's privacy may be violated if security measures aren't used properly or if policies and procedures aren't in place that determines what type of information can be retrieved, by whom, and for what purpose. Again, the disadvantage of computerized documentation of the nursing process is concern for privacy. Number 16. The theorists who believe that adaptation and manipulation of stressors are related to foster change is? The correct answer here is letter B, Sister Callistaroy. Callistaroy's theory is called the adaptation theory, and she viewed each person as a unified biophysical system in constant interaction with the changing environment. Orem's theory naman is called self-care deficit theory and is based on the belief that individual has a need for self-care actions. King's theory naman is the goal attainment theory and describes nursing as a helping profession that assists individuals and groups in society to attain, maintain, and restore health. And sa letter D, Virginia Henderson, siya naman yung nag-introduce sa nature of nursing model and identified the 14 basic needs. Okay? Basta adaptation and manipulation or yung adaptation theory is Sister Calista Roy. Our answer here is letter B. Number 17. Formulating a nursing diagnosis is a joint function of, our answer here is letter B, nurse and patient. Although, diagnosis is basically nurse's responsibility, pero input from the patient is necessary to formulate the correct nursing diagnosis. Tandaan natin yan. Formulating a nursing diagnosis is a joint function of nurse and patient. Number 18. Mrs. Kaperlak has been diagnosed to have hypertension since 10 years ago. Since then, she had maintained low sodium, low fat diet to control her blood pressure. This practice is viewed as A. Cultural belief, B. Personal belief, C. Health belief, and letter D. Superstitious belief. X na agad yung superstitious belief. So, ang sagot natin dito is letter C. Health belief. Health belief of an individual influences his or her preventive health behavior. Okay? Sagot? Letter C, health belief. Number 19. Becky is on NPO since midnight as preparation for blood test. Adrenocortical response is activated. Which of the following is an expected response? A. Low blood pressure. B. Warm, dry skin. Letter C. Decreased serum sodium levels. And letter D. Decreased urine output. The correct answer here is letter D. Decreased urine output. Adrenocortical response involves release of aldosterone that leads to retention of sodium and water. Again, adrenocortical response involves release of aldosterone that leads to retention of sodium and water. This results to decrease urine output. Sagot? Letter D. Decrease urine output. Number 20. What nursing action is appropriate when obtaining a sterile urine specimen from an indwelling catheter to prevent infection? A. Use sterile gloves when obtaining urine. B. Obtain the drainage bag and pour out the urine. Letter C. Disconnect the catheter from the tubing and get urine. And letter D. Aspirate urine from the tubing port using a sterile syringe. The correct answer here is letter D. Aspirate urine from the tubing port using a sterile syringe. The nurse should aspirate the urine from the port using a sterile syringe to obtain a urine specimen. Okay? Number 21. A client is receiving 115 ml per hour of continuous IVF. The nurse notices that the venipuncture site is red and swollen. Which of the following interventions would the nurse perform first? A. Stop the infusion. B. Call the attending physician. Letter C. Slow the infusion to 20 ml per hour. And letter D. Place a cold towel on the site. Nakita daw ng patient na nag-red at nag-swollen yung venipuncture site. Which of the following interventions would the nurse perform first? Our answer here is letter A. Stop the infusion. The signs and symptoms indicate extravasation, so the IVF should be stopped immediately and put warm, not cold towel on the affected side. Okay? Number 22. The nurse enters the room to give a prescribed medication but the patient is inside the bathroom. What should the nurse do? A. Leave the medication at the bedside and leave the room. B. After a few minutes, return to that patient room and do not leave until the patient takes the medication. Letter C. Instruct the patient to take the medication and leave it at the bedside. And letter D. Wait for the patient to return to the bed and just leave the medication at the bedside. The correct answer here is letter B. After a few minutes, return to that patient's room and do not leave until the patient takes the medication. This is to verify or to make sure that the medication was taken by the patient as directed. Huwag po nating kakalimutan. Next, number 23. Which of the following is inappropriate nursing action when administering NGT feeding? A. Place the feeding 20 inches above the point of insertion of NGT. B. Introduce the feeding slowly. C. Instill 60 ml of water into the NGT after feeding. And letter D. Assist the patient in Fowler's position. So, negative answer po ang hahanapin natin. So, the correct answer here, which is inappropriate nursing action when administering NGT feeding is letter A. Place the feeding 20 inches above the point of insertion of NGT. Masyadong mataas na po ang 20 inches that will cause the feeding to enter the stomach too rapidly and this can potentially cause discomfort, nausea, and vomiting. Tanong, gaano ba dapat kataas? The correct practice is to position the feeding container at a moderate height, typically around 12 inches above the insertion site. Typically 12 inches above the insertion site. Okay, yung 20 inches, masyado na pong mataas yan. Number 24. A female patient is being discharged after thyroidectomy. After providing the medication teaching, the nurse asks the patient to repeat the instructions. The nurse is performing which professional role? A. Manager, B. Caregiver, C. Patient advocate, and letter D. Educator. The correct answer here is educator. When teaching a patient about medications before discharge, the nurse is acting as an educator. A caregiver provides direct care to the patient. As an educator, the nurse is responsible for assessing the patient's learning needs, developing and implementing teaching plan, and evaluating the patient's understanding and retention of information. Therefore, our answer here is educator. The nurse acts as patient advocate when making the patient's wishes known to the doctor. Patient's advocate involves supporting and promoting the patient's rights and interests, but it is not directly related to teaching and evaluating patient's understanding. Huwag po tayong mali dito. Number 25. Which data would be of greatest concern to the nurse when completing the nursing assessment of 68-year-old woman hospitalized due to pneumonia? Again, which data would be of greatest concern to the nurse when completing the nursing assessment of 68-year-old woman hospitalized due to pneumonia? A. Oriented to date, time and place. B. Clear breath sounds. Letter C. Capillary refill greater than 3 seconds and buccal cyanosis. And letter D. Hemoglobin of 13 grams per DL. The greatest concern to the nurse daw po, sagot, our answer here is letter C. Capillary refill greater than 30 seconds and buccal cyanosis. This indicates decreased oxygen to the tissues which requires immediate attention or intervention. Yung letter A, letter B, and yung letter D are normal data po. Okay?